have your name and date of birth? Thank you, Mr. Blake. I'm going to give you some privacy by pulling your curtain. Today, I'm going to insert a Foley catheter to relieve the pressure in your bladder and help you urinate. I'm going to adjust the bed for the procedure so it's easier on both of us. I'm going to uncover you real quick. I know it's cold, I'm sorry. I'm going to adjust your legs so that the catheter can go in a little bit easier. I'm going to place this incontinent pad up under your buttocks. Okay. I am going to perform some hand hygiene and grab a pair of gloves. And then I'm going to clean up your perineal area. Cover your legs back up for now, so that you're not too cold. Got this warm water and soap. Okay, then I'm going to use this dry washcloth and pat you dry. Okay, Mr. Blake, now I'm going to perform hand hygiene. I'm going to uncover your legs real quick. And we're going to start setting up the sterile field for your catheter. I'm opening the sterile field away from me. And I'm going to remove my sterile gloves. Now I'm going to place this waterproof pad under your butt. Make sure to keep your bed nice and clean. Okay, now I can set up my supplies. I have my lube. I have our swab sticks. I'm going to prepare the catheter. sure the cord is untangled. I am first going to insert the tip into the lube, about 1 to 2 inches, and I'm going to attach the flush that will inflate the balloon. Okay. I'm now going to take my hand. This is going to be clean now and not sterile. I am going to use 1 swab stick. Another swab stick. And the last one will go directly over the meatus. Now, holding about 2 to 3 inches, I will insert the Foley catheter. Using my non-dominant clean hand, since I'm not going to be pulling it in or out, I'm going to secure the catheter and inflate the balloon. I'm going to gently tug to ensure placement. I'm going to remove my gloves. Now, on the document, it says to secure the Foley bag first, but Professor White said that since those gloves have like lube and have been touching the peri area, she recommends doing hand hygiene and donning a clean pair of gloves, and then securing the Foley bag and cleaning the peri area up again. There we go. I'm gonna give it a little bit of leeway so that he can move his legs a little. And tape it down so that the port is still accessible. I'm gonna make sure there are no kinks in the Foley. And hang it onto the side of the bed. I'm going to take a clean washcloth, make sure there is no betadine solution left in the perineal area. I'm going to take a dry washcloth and pat him dry. I will then remove my sterile field from the patient's bed and discard of it. And discard of it. We'll cover the patient back up. I'm going to give the patient his call light in his hand. Maybe lower his legs so he's a little more comfortable. The side rails are already up, but if they weren't, I would put the 2 top side rails up. And I'm making sure that the bed is in low position. Our situation today, this is Mr. Jamie Blake. He is in here and getting a Foley catheter due to incontinence for 3 days. He has benign prostate hyperplasia, which causes his urethra to be kind of compressed and gives him trouble urinating. He has needed 3 Foley catheters in the past 4 years, not gotten a UTI from any of them. His vitals today are, he's got 98.6 degree Fahrenheit temperature. He has a 68 beat per minute pulse. He has 18 respirations per minute. He's got blood pressure 140/89, which is, it's high, but we're gonna keep monitoring it and make sure he takes his medications. And then 96% oxygen saturation on room air. The Foley insertion went well. He tolerated it without any pain. We used a 14 French catheter with a 5 milliliter balloon inflation. He got 300 mils of urine out immediately. It was an amber color and it was cloudy. I would recommend that the oncoming nurse keeps track of his intake and output. I would recommend that if it continues to be amber in color or cloudy, that she asks the doctor for a urinalysis, and just make sure to complete the peri care and the Foley catheter care to keep him